We've got a practice with about 10 clinicians running out of it. We've got really diverse demographics: surfers, golfers, billionaires, backpackers, the works. Really active lifestyle down there. So lots of people with lots of various injuries. We don't really specialise in anything particular, but we have to know everything about the body, ideally.
Fantastic.
Yeah.
And what attracted you to our course, courses?
To be honest, being a runner and having hip problems, I wanted to sort myself out. It was part of it, but also I have lots of higher level patients that have had some hip problems that I haven't been able to sort through. So really knew that there was a bit more depth and complexity that I wasn't getting to, and as much reading as I could do and podcasts and things just didn't give me the knowledge that I wanted.
And on that note, have you found the content to be useful in that regard?
Awesome, it's been great. And I really love the ability just to apply it straight away. So learnt checklists, learnt good assessment and diagnosis. And often it's about relearning what you've forgotten as a clinician, and there's a bit of that too, which is really good, and that bolstered what I already knew or reminded me of what I'd forgotten. But then moving forward, there's some good strategies and skills I've learned to apply. So that's great.
And you think you could take that on Monday, Tuesday and apply it straight away?
Yep, absolutely. So we've got some physios. We do a study group, so I'm going to present to those guys down there and feel, I'll read through the notes, but feel confident already just to go and start applying it. And I've already in my head thought about patients I want to apply it to. And yeah.
Awesome. So we might be back next year. Any of your colleagues or other physios that were interested, what would you say to them?
100%. It's one of the best courses I've done, and I've been a physio 15 years. So yeah, really good balance of practical and the evidence base, which is not a strong point of mine. I've got to do a bit more evidence base, but yeah, that's a great little balance, and yeah, I definitely recommend it.
Lovely, thank you very much.
On my assessment skills of the hip,
to get
be a
that
bit more
shot.
specific between the hip and everything around it.
And how about you?
The same as that, trying to differential diagnosis with the hip and back and everything that can refer in that area. And we've also had a few runners coming into the clinic lately, so I just wanted to have a bit more of an idea of what to.
So obviously areas, what you found useful so far?
The layer concept of the hip, that was really good, just a nice kind of easier way to break it down and work out where the symptoms are coming from and narrow it down.
And how about you?
Yeah, I agree, and you kind of make sense of what you find in your assessment as well, and link it up to different diagnoses.
And do you think it'll influence your practice?
Yeah, especially doing the capsular stuff last, so that you're not flaring them up, because I think that's a big thing at uni.
Not
Everything is, you kind of go in, do all your fader and faber, and sometimes flare them up. It's a great weekend, and it's got a lot of information that we can use with our clients.
Yeah, and do you think it's clinically relevant for current?
Extremely. Yeah.
Okay. Brilliant, thank you.
I'm a musculoskeletal physiotherapist. I own my own clinic in Fremantle, and I'm currently undergoing specialisation training. The reason I came on this course is I think anterior hip pain, femoral acetabular impingement, how to manage, how to diagnose those sorts of injuries was a sort of a weakness of mine. I was pretty happy with some of the diagnosis, but not really the in-depth sort of understanding of the mechanics and how you would treat that. So I'd seen Benoy on Twitter and followed some of his threads quite a lot. So when I saw that Doug was putting out a course on the hip and running, I thought, that's probably the course that I'm going to jump on this year. I think understanding the pathoanatomy behind things that lead towards some of the hip sort of presentations that we see, how you can get onto it early and how to manage those with a much better sort of structure, really. So clinically I'll have different things that I'm looking for. I'll be asking a lot of other questions in my subjective assessment based on the development of this presentation. So there's already a couple of real clinical pearls I think in there that's going to help me with future patients for sure, and even past patients that hopefully I'll be able to see again.
And do you think you can use the information clinically and apply to your patients when you're seeing in your clinic? Yeah,
I think so. So especially ones that have recently had maybe a hip arthroscopy, some of those types of presentations where I might not have been as confident to manage them through the early sort of stage of rehab. There's certainly a lot of wealth of information in the course on how to manage those patients. So for sure, if you want a good hip and running course. I think this would probably be money well spent for 2 days. Just going into the second day now, we're focusing more on the running, and there's some excellent rehab ideas. There's some really good structure in how you would take people through a rehab program from, you know, a fairly sort of intermediate to a more elite sort of program. So yeah, I would highly recommend this course for sure.
So working kind of just 4 days there. I'm actually also studying a postgrad in women's health, and but I've always had an interest in like the pelvis and the hip and the back and that kind of thing, so I thought that would tie in well. But my husband and I are actually opening a clinic down in the country, down about 3 hours south of Perth.
Fantastic.
So get some different manual therapy techniques that I hadn't seen before. I'd used the belts a bit, but there was a few extra ideas, and also to get some great ideas with the plyometrics as well. I use that a lot in the Pilates and the rehab that I do, but there's a few different things I hadn't seen. With all the runners that I see, I've done a bit of the running assessment before, but I've never had specific parameters to give to those runners in terms of returning to exercise. So it's good to have some really specific things to be telling them what they can and cannot do, and also realising how different it is managing an Achilles injury versus like a knee injury. So yeah,
Brilliant.
It's been really good.
So do you think you can take things we've taught and apply it on Monday morning?
Yes, yeah, definitely. Yeah, I actually have a patient that's due for a running assessment on Monday. I've been thinking about her and things I'm going to be saying to her.
Perfect.
So yes, yep, 100%. Definitely recommend it, especially because evidence is always changing so much. Even if they graduated a few years ago, there's always new things to be learnt, and it's really good to hone in your skills and get a bit more confident in the rehab side of things, not just the manual therapy. So
18 months, 14 months, and complete, break, coming back in. And I'm in my 50s, so possibly a little bit behind on what's happening, particularly rehab, retraining. I'm a manual therapist, MANIPS. So this was looking like it was a broad course to cover, although it was hip, it's going to touch on a lot of areas of tendinopathy, and theory is just amazing. Like, it's packed with all sorts of wonderful percentages, which I just love, about who gets injured, occurrence rates, predispositions to injuries. So it really makes you think when you've got clients in front of you about the benefits of doing something versus the risk of doing it, puts that in a really numbers crunching way. I love that. So I've pestered you in the breaks and during the sessions in relation to particular clients, and getting really good feedback straight away to go back into clinic and know what to do. Great time investment, 2 days, and you come out with what might take you years to read and ask your mates about it.
Thank you.
Diagnosing all the different hip pathologies and not getting confused on that. So it can all well be good in treating the hip, but not necessarily a lot of the times knowing what's going on and being able to differentiate between the hip and the back. So that was a big one in terms of diagnostics. But also exercise prescription was a big one as well, and doing all the different types of techniques that you can do to rehab them back to full function. Yeah.
And what do you think you can apply to your patients going back?
My client base is very athletic, so a lot of deep squatting, like CrossFit-y kind of stuff. So learning all the parameters and how to load them safely and correctly, and technique adjustment, but then also knowing the diagnostic side of things as well. Yeah, most definitely worth it. It's a very fast-paced course in 2 days. However, there's like a lot of interesting points that you can note down. So although it is like fast-paced, you learn a lot, tons of information. These guys are walking encyclopedias.
Okay, thank you guys.